All right. So, in a move that should come as a surprise to really nobody who's paying attention, Louisiana banned staff from helping people get Mpox, COVID, and flu vaccines. Officials in Louisiana held a series of meetings in October and November telling Department of Health staff that the state would no longer allow them to promote COVID, flu, and Mpox vaccinations. So they don't want them to do their job. Cool. The new policy would be implemented quietly and would not be put in writing, 4 health department employees told NPR. They asked to remain anonymous. The directive was shared by 2 lower-level officials in the department after the state surgeon general was unable to attend, the staff members said. Employees were told they could not send out press releases, give interviews, hold vaccination events, give presentations, or create social media posts encouraging the public to get vaccines. They were also barred from putting up signs at the department's clinics announcing COVID, flu, or Mpox vaccines were available on site. I mean, do they want to dismantle public health? One health department staffer asked. Yes. The answer is 100% yes. In 2023, 652 people in Louisiana died of COVID, including 5 children, and the state is tied with Washington, D.C. for the highest rate of flu in the U.S. Flu killed 586 people in Louisiana in 2022, according to data from the state's health department. As of August 2024, the U.S. reported 60 deaths and 33,435 cases of Mpox. 309 cases were reported in Louisiana through February 2023, the last data available before the state stopped reporting cases. Because as we all know, if you stop reporting cases, they stop happening. Okay, why aren't you moving? I'm very surprised that anyone would call a state meeting, not provide an agenda for that meeting, not provide a written set of notes from that meeting, said Kimberly Hood, who led the Office of Public Health, a subunit of the Health Department from 2021 to 2022. I think that, to me, it sounds like people are trying to avoid public records laws. Well, yeah, because obviously if people knew what they were up to, people might get, upset and want their health officials to, care about public health and care about people getting vaccinated. The policy change can be traced back to Governor Jeff Landry, of course a Republican, an anti-vaxxer who served as the state's attorney general during the COVID pandemic, as well as Robert F. Kennedy Jr., a Landry ally and Donald Trump's pick to head up the U.S. Department of Health and Human Services. And this is the man who said when people started worrying about his vaccine stance, and he was named to this department head. I shouldn't say named. He was picked. And his response was, we're not going to ban vaccines. Really? Well, technically, I guess you can't say it's a ban. They're just making sure that nobody knows they exist. So, basically, yeah, it's a ban. In his role as AG, Landry spoke at a state committee hearing in 2021 about his opposition to adding the COVID vaccines to the childhood immunization schedule. Kennedy testified alongside him, presenting false claims about COVID vaccines, as he's been doing all along. As Governor Landry has signed 5 bills and 2 resolutions this year, rolling back vaccine requirements, limiting the power of public health authorities, and questioning vaccine safety. Landry appointed Dr. Ralph Abraham, a family medicine doctor and another vaccine skeptic, to be the state's Surgeon General. I see now vaccine injury every day of my practice, Abraham said at a 2024 legislative meeting on the state's response to the COVID pandemic, linking vaccinations with autism. Despite the fact that the study that initially got this vaccines called autism ball rolling was debunked, it just keeps finding new life. Ironically, the guy who did that with the MMR vaccine didn't want to say vaccines in general cause autism because he wanted to market his own vaccine. The adverse effects of the COVID vaccine have been suppressed, he told legislators. In a statement, the Louisiana Department of Health told NPR it has been reevaluating both the state's public health priorities as well as our messaging around vaccine promotion, especially for COVID-19 and influenza. Yeah. Louisiana wants to see more deaths. They probably looked around and said, not enough people are dead. Let's take all their vaccines away and see how many of them survive. So yeah, that's great. But since it's the Department of Public Health, I don't know, maybe it's directed towards low income. Because you go to a doctor's office and the doctor will ask you about vaccinations. It's not like the Department of Public Health can prevent doctors from telling you about vaccines. So it's entirely possible that this is directed towards the poor and the elderly. The poor because they're usually the ones who get notices from the public health department. And obviously they set the stage for other physicians, but I don't know. I would think that physicians would not just listen to their public health department. They have the CDC, they have WHO, they have other places to go to. So I'm thinking that this is targeting the poor and, of course, the elderly, because guess who, and the very young, because who's more likely to die of flu? It's going to be the very young and the very old. So, yeah. The department described the move as a shift away from one-size-fits-all paternalistic guidance to one in which immunization for any vaccine, along with practices like mask wearing and social distancing, are an individual's personal choice. Okay, if these people who wrote that are truly public health officials and actually care about public health, it must have killed them inside to write that. Because they know damn well that the people who get vaccines are doing it first for themselves, because even if they do get sick from, say, flu or COVID, they're less likely to die. Their symptoms are going to be less severe. So that's not a one-size-fits-all paternalistic guidance. It's not just about you. It's great if you want to risk your life that, if you got COVID or flu, that it won't kill you. The problem is that if people start thinking, you know what, it's not going to affect me, so I'm not going to get vaccinated, then the people who rely on herd immunity, those who are are immunosuppressed and immunocompromised, then they're screwed. Because they're relying on the rest of us to have the vaccines to be immune from these diseases, so it's less likely that they're going to catch it, because if they catch it, they are going to die. But, we live in a society where everything is me, 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 and if it doesn't affect me, well, does it really matter? The statement did not address Mpox vaccinations. And I don't know enough about how that is spread to know if that's a concern. But especially since I think it's mostly in Africa right now. I could be wrong. It could be one of those that came here from Africa. Well, came here from overseas, definitely. So, yeah, if you're going to go overseas, you probably should get vaccinated, especially if you're going to a place where this is a problem. Just like when COVID became a problem and there were so many people who were against the vaccine, so much so that the rest of the world was warning their residents that if they were coming to the U.S., this is what to expect. Anyway, the health department's new unwritten guidance against vaccine promotion is malpractice, said Dr. George Benjamin, executive director of the American Public Health Association. The U.S. vaccination program represents one of the most important public health interventions that we have, Benjamin said. Anyone who's articulating that these vaccines are not well tested, they're not safe, they're not effective, is not giving you the science as we know it today, he added. But, people don't care about science. They don't care about facts. Former health staffer Hood said the false claims are a step backward. It's a medical marvel that we're fortunate enough to live in a time where these vaccines are available to us, she said, and to not make use of that tool is unconscionable. Exactly. People who have survived horrible illnesses, like, say, Mitch McConnell, who's a polio survivor. Actually, it's entirely possible that that's why his face looks like it's paralyzed when he talks. I don't know for a fact, but maybe that was a symptom of surviving polio. I don't know. But the point is, those who have survived these horrible illnesses, like Mitch McConnell surviving polio, they know that, trying to downplay vaccines and thinking that people shouldn't get vaccines. I mean, it's great that you think it's a personal choice. That means that this should be something that you discuss with your doctor. But if it's a personal choice, then at least promote it. Because the best way for someone to choose whether vaccines are right for them is to still be informed. And if they don't even know these vaccines exist, how the hell are they informed? So they're saying that we want this to be a personal choice, but what they really mean is we want you to choose what we want you to choose, rather than truly it being a personal choice. So, yeah, I'm pretty sure that if RFK Jr. is confirmed as the new Health and Human Services Secretary, this would just snowball across the country. That they would take away the promotion of vaccines. Even if they don't out and out ban them, it'll only be people who are already aware that these vaccines exist and approximately what season they're available, and they go to their doctors who are going to be aware that, okay, it's time to get these vaccines. Okay, I turned age 50 and now the new guidelines say that I'm a candidate for the pneumonia vaccine. Okay, great. You don't have to wait for your doctor to say something. You could go to a pharmacy, or you can schedule an appointment with your doctor or nurse. So that's personal choice. Okay, I'm 53 years old. The pneumonia vaccine is now available to me. I don't have to wait to 65. So I can actually go and make an appointment. Be proactive. Make an appointment. That's still my choice. But that's only because I'm aware that the guidelines have changed and I want to get the vaccines when they are most beneficial to me. So if I don't see how me not knowing that the guidelines have changed helps me in any way. I mean, obviously, I'm not going to ask for a vaccine that I think I'm too young for. I mean, maybe my doctor will say, oh, so are you ready for your pneumococcal vaccine? That's a possibility, but, maybe your doctor's appointment is, when it comes to like the flu vaccine, maybe your doctor's appointment is outside of flu season. Well, they're not going to offer you the flu vaccine outside of flu season. So if you don't know it's available, or you don't know when flu season is, how are you going to know it's time to get it? And yeah, there's so many holes, it's like Swiss cheese. Anyway, that is all I have for this video. And with that, I will see you guys in the next one.